Good afternoon. I'm speaking to you live just outside.
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
What's happening, Joe? How are you, man?
Not a whole lot, Spencer. I'm good. How are you?
You know what? Usual bullshit. Just the usual bullshit. Have a good show.
Just the usual BS.
Anyway, 888-659-3727. If you are new to the broadcast, I'm Spencer Kobren. I'm the founder of the American Hair Loss Association and the author of The Bald Truth, the truth about women's hair loss. Also the founder of the International Alliance of Hair Restoration Surgeons. Joe Tillman, my partner in crime here, which is not, I shouldn't have to explain this to you. He's not really conducting crime, neither are we. That's a
Do we really have to explain that?
Term of endearment. We do with these people, because all of a sudden, one of the detractors will put that out there. You see?
They're admitting it. They're criminals.
Yeah.
They're working with Merck.
Jesus, Merck shills. Joe Tillman, the original hair transplant mentor, guy who's been in the space for well over 2 decades, knows where all the bodies are buried when it comes to anything and everything hair transplant surgery. A recipient of 10 hair transplants himself, with excellent results. 2 not so great. The rest were good.
That's what got me in this biz we call hair to begin with. 2 bad surgeries.
2 bad surgeries. Check, check, check. Okay, I can hear myself. Yeah, this is our live broadcast. We do it every week, mostly every week, around 3-ish Pacific time.
3-ish.
3-ish, whenever we can make it. Today I will bow down to Joe for being on time and for me being slightly later, having to deal with some stuff and embed the show and whatever else I had to deal with. So I apologize for my tardiness.
We forgive you.
Thank you.
It's all good.
Thank you. Well, you owe me a Instagram.
If we weren't late, then what the hell else would Rob Hellner have to do with his time?
That's true.
But to sit there in the chat room and say that we're going to be late and make up, and come up with these ideas. Week as usual, it'll be Joe's fault today. It'll start at 6:15 or 6:30, or Spencer spraying his bald spot. LOL.
That is true. That fucking Rob. 888-659-3727 is a toll-free number. It is great to be here. Thank you guys so much for hanging out for the live broadcast. We're here to answer your questions about anything and everything hair loss, and really to tell you the truth about this fucked up industry. I've been sent for whatever reason, several links this week to just more bullshit that just kind of reinforces the pure just evilness and this fear of loss and competition amongst people who claim to be there to help the hair loss consumer. And I'm just like, the guy who sent me this stuff, I was just like, whatever, dude. I don't need to read this shit. What's it going to do for my life?
No, I do know, and that's a great question. How does this affect me? What does this do for me?
Yeah. If there are people out there that are haters, there are people out there that are trying to be detractors against what we do, what I've done, or there's a reason for that, yo. And honestly, it hasn't seemed, at least for the last 25 years, to have affected us in any meaningful way. So the more you concentrate on negative stuff, and I think the guy out there is listening, the more it takes away from your life. You just put your head down, you keep doing what you're doing. There will be people who find us who realize, holy shit, why did I listen to these other motherfuckers? Strike three. Now they're over here like, oh man, we should have taken your advice. Well, with that said, our advice isn't always correct either. We give the best advice we possibly can, but we're not doctors, and we're also not gods. I have no way of controlling the outcome of a doctor who's having a bad fucking day. That's your choice. We're just here to provide you with the information so you can make informed decisions before moving in any direction, whether buying a product or a service or getting surgery. 888-659-3727. I'm going to let Joe ponder that one. I'll take a call. Hey, you're on the air. Who's this and where are you calling from?
Hey, hi.
Hey.
The name is George.
Hey, George.
How you guys doing?
Hello, George.
Where are you calling from, George?
Pretty good.
I'm calling from NYC in the place to be.
All right. George from New York.
Okay.
Yes. Joe, I did send you some pics, I think about a month and a half ago. I wanted to see this doctor in Spain, who's considered the best in the world. I don't know. But anyway, so I do show some shedding, but when I comb my hair, it doesn't look like I'm losing hair, but at the same time, it just doesn't look right, as it did before when I had more hair. Do you know what I mean? So
Yeah.
you mentioned to me that I don't need a hair transplant, but something in the back of my head says that I should get one and I should bite the bullet. Right now I'm really completely indecisive. I'm in a fatalistic position here mentally, so I really don't know what to do. Maybe you could help me with that. I don't know.
Give me a clue. I have an idea of which doctor you're talking about. Was it Kuto?
Yeah.
Yeah, and this. Okay, so I'm just trying to. I'm looking. When did you send it to me?
Let me look into my IG and just give me 1 second.
Oh, it was on Instagram. Okay, sorry. Yeah. While you're doing that, I don't remember your photos. I see so many, but if you're talking about how your hair just doesn't look right, like that's not grounds for a hair transplant, because if there's no clear cut area of loss, where's the new hair going to go?
Oh, okay, so let me just rephrase what I said. Maybe I used portraits. Okay. I used a portraits word. So when I style my hairstyle just doesn't look as good as it did before with more hair. That's what I meant to say. It looks kind of lopsided. Right. It's you know what I mean. When you have more hair, you have better styling options.
Right.
And so, because I've lost hairs in the temple area, and so if you can go back to January, just give me 1 second, Joe. January the 1st.
Okay.
Or actually, just give me 1 second. Yeah. Okay. So I did send you pictures on December the 15th.
Oh wow. Okay, so it's hard. Like Instagram doesn't show the dates past a couple of weeks, so it's hard to find this without your username, and you don't need to give that away.
Okay. Can I send you the pics now by email? I'm at my PC. If that's okay.
We'll just go back on Instagram and resend them to me if you got them on your phone.
Okay. Yeah. Absolutely.
Yeah.
No problem.
I mean, it's much easier to see it, when it's fresh. So, but while you're doing that, like, continue down this line of thought. Like, it doesn't look right compared to when you had more hair. What's your hair loss pattern?
So temple areas I've got issues with, and the front of my scalp I'm shedding a bit. It's not as full as before.
Okay, so this is a frontal region situation only. Maybe a Norwood 3 or not even that bad?
No, not that bad. Like when I style my hair, it doesn't look like I'm losing any hair. It looks like I have hair, like a lot of hair, but I gotta like style it to the side in order to get that effect going.
Okay, and your medication history, like are you taking medication for your hair loss?
No, I can't take medication for hair loss. I can't.
How old are you?
I am 50.
50. Okay. All right. So that makes things a bit different because when you're our age, it's not quite as imperative to take medication. But I do still, I don't know if I put it in my message to you, but I do still recommend doing everything you can non-surgically to stop your loss. And oral minoxidil, topical finasteride, PRP, something that can help thicken what you have, to where even if you do wind up needing to have a surgery, it can reduce the amount of surgery that you need to have, which maintains your donor area, it keeps the integrity stronger, and costs less money. Fewer grafts cost less money. So, you still have options. Have you sent those photos yet?
So I'm unable to I have the photos on. I see the photos on Instagram in the conversation that we had, but I'm unable to send them to you. I think I have to
send me any message because it'll be in our history. Just any message.
Okay.
Just say hi.
Okay, I'll send. Okay. All right. Okay, I just sent you a hi.
Ah, there you are. Ah, okay. Thanks, George. Not your real name. Okay.
Yeah, I know.
Okay. Oh, yeah. Oh, I remember this. Okay.
Yeah.
Yeah, you got a mop of hair, man.
Yeah, thanks.
But I see your issue. Yeah,
Yeah.
No, I see your issue. I see it. You actually look like you're developing an isolated forelock. And you're doing a little bit of a comb over the front.
Correct.
Man, I'm telling you, flock of seagulls called. They want their hair back. Jesus Christ, dude.
Yeah, my sister
God.
calls me. My sister calls me John Taylor from Duran Duran.
Yeah. Oh my God, that's it. Can I show this on screen? Because your photos are blocked out. Or your face is blocked out.
Yeah. That's fine.
Okay, so what I'll do, I'm going to show some images with your hair styled. So see what we can do there. So everyone can see that. And then, let's see. Let's do another angle shot here. Can you see that, Spence?
Yes, I can.
There we go. There's that, and then
it's almost like what I'm trying to go for, which I just can't do it.
And then there's the real story.
I hear you, brother.
And then let's see. Here's the other side.
Yep.
And here's what it says it all. Like, look at that comb forward action going on.
Yeah.
Yeah. Okay. So, all right. And what did I say to you? I said, I don't think you need a hair transplant, but your hair is thinning in the front. So what I do suggest is visit IHRS accepted member doctor, or even better, visit a doctor. Get an assessment, move forward with medical therapy, and anything else that isn't surgery. Stopping the loss is the first step. You may get some improvements, but you have to stop the loss before you try to reverse it with surgery. It's not like brushing your teeth.
Right.
It's like not brushing your teeth and you have new crowns put in. Yeah, okay.
So let me just interject here for a quick second, Joe, just to let you know. I did have I did contact Dr. Bobek. I had a video conference with Dr. Kodo. So Bobek suggested that I do 2,500 grafts. Kodo suggested 3,000. Deep also suggested, I forgot the name of this doctor. He suggested also 2,500. But anyway, it's in the ballpark figure around 2,500 to 3,000. So,
yeah.
Do you think that given their analysis of what's going on, that I do require, well, not require, but that hair transplantation may work in my case?
Well, I mean, what do you mean by will it work? Are you talking about will it grow?
So what I mean by that is, will it give me more volume without any issues in terms of shock loss?
No, no one on this planet can tell you if a surgery will cause shock loss or not. There's no
Okay.
I challenge anyone. Call in, explain why you can guarantee yes or no, because there's no way that I've ever heard of, because there are multiple factors that can cause shock loss. Now, when you ask about shock loss, you have to define: are you asking about permanent shock loss or temporary shock loss? Because those are two different things.
Yeah.
Okay, well, temporary shock loss is a high likelihood simply because of the nature of surgery itself. Because especially in a case like yours, where you're placing a lot of grafts into a relatively small area, and you're going into areas of existing hair in that forelock region, and so you're going to have two issues that happen. You're going to have the shock loss of the grafts that are placed, because once they're placed, those grafts or the hairs inside those grafts will shed, and that's also known as surgical, or I guess you could refer to it as immediate post shock loss, because it happens a few weeks after the procedure. But then you also have shock loss of any hair around the peripheral region of the placement because of an interruption of blood flow. That in and of itself can cause those hairs in that immediate region to transition into catagen, then telogen, and you're in the ugly duckling stage for the next 3 to 5 months.
Right.
So if you're asking for guarantees that you can continue with this hairdo facade that you're doing, not going to happen. You may be able to continue, but it won't look. I mean, there's a good chance that the lack of fullness that you're complaining about will be greatly exasperated because of the surgery. Even if they do what's called a long hair transplant, where they're not shaving your recipient area in that forelock, I would wager that you got a better chance of it happening than not happening. And I'm talking about temporary shock loss. Permanent shock loss comes from just carpet bombing an area way too much, compromising the blood flow to where where the surgeon doesn't actually assess your recipient site region, where the skin tissue itself can cause issues where it's not just an interruption of blood flow, but it can cause pooling of blood underneath the skin, which is a hematoma. Hematoma?
Yeah.
Hematoma. And then it can lead to necrosis.
Right.
You don't want that. It's rare, but you don't want that. But I mean, you can't move forward and expect there to be zero evidence of anything having happened that doesn't disrupt your normal hairstyle. You got to be able to take it for the team. That's all there is to it. Or be willing to, I should say.
Right. So, wow. I'm stuck between a rock and a hard place. I really don't know. And it's.
I know. I get it. I totally get it, man. I totally get it. This is one of the problems. Yeah. No, I totally get it. Like, I've dealt with this so many times I can't count, because one of the biggest fears that guys have historically that are dealing with hair loss and want a hair transplant is not interrupting their daily routine so that no one knows, so that their hairstyle, like whatever they're doing to hide the hair loss, they don't want to have to give that up, and they want to be able to transition into a normal life several months down the road as the hair transplant grows in, with no one around them actually seeing anything different. It's just not possible. Like, there are exceptions to the rule, but you're asking. I'm trying to think of an analogy. You're asking. I can't come up with one right now. It's just really difficult because of the shock loss issues, because of the potential downsides, the potential side effects, negative side effects of the surgery. you have to really come up with a way that you can deal with this, that you can tolerate for the next several months. But this is again why I think that surgery is not a great idea, because what happens if it doesn't, what happens if you do have some sort of negative side effect, being at the very least some sort of long-term shock loss? Like, how are you going to deal with that?
I don't think I could.
That's
to be
the
honest
problem.
with you, I really don't think so. Yeah, that's the problem, right? Exactly.
Surgery's not for you yet. If you can't deal with the possible downside, then you got to just rock that comb over until you got to shave.
I was actually thinking about PRP. At least that's, there's no butchering going on.
No butchering, PRP, but hang on.
Yeah. Okay.
Let me just address any sort of approach that you are considering, and that's including medical approaches. Anything that you're doing to positively enhance your growth cycle can at the same time create a temporary reversal of what you're looking for. In other words, anything that you take, it can affect the growth cycle. If you start taking finasteride, if you start taking minoxidil, if you have PRP, if you try laser therapy, all these treatments affect the growth cycle, and it can induce some sort of effluvium reaction to where you have more of an issue that you're trying to hide now before it actually gets better.
Yeah, and the point isn't about being butchered. You can go to the greatest surgeon in the world and have a good result, but you could still deal with shock loss and then have to wait a year for it to grow in. It's unlikely that it's going to be permanent, but it's possible that it can be. And these are all things you have to put into your equation when making your decision. If you can't deal with any of it, then you shouldn't be cut. And if you can't deal with the possibility of shock loss, even if it's temporary, from having some type of medical intervention like PRP, then that's not for you either. You have to understand that there's, for every possible benefit, there's a risk.
Right. So and I appreciate that, Spencer.
Yeah.
So considering what we've discussed, my next question is, why would Baalbek, Kodo, and a couple other doctors recommend grafts? Why didn't these guys tell me exactly what you've said? That's what I don't understand.
Because they're in the business of performing surgery, and you probably, to me, I think that you could probably have a successful hair transplant given the amount of loss that you have, and that you would see a marked or market improvement if it was done well. Mm-hmm. But, did you speak to them about your fears?
No.
That's the question.
Not.
Yeah. So, I mean, if you're not open to them about your fears, so what are they going to do? Say, we could help you, but this could happen, that could happen, this could happen. You could be fucked up. We could mentally destroy your life. That's not going to happen during your consultation, dude.
Right. No. I understand.
So if I were to look at you if I were a physician who performed hair transplants, how old are you?
50.
Okay. Given your age, given the progression of your loss, I would say that you would make a pretty, I'd have to take a close look at your donor. I would say for taking out of the equation your mental status or your ability to deal or not deal with something happening, I would say based on those images, you make a good candidate for hair transplant surgery. But that does not factor in all the other shit that we've been talking about.
Right.
Yeah, and that's the thing. It's like when I don't know about Dr. I know nothing. Well, I know a few things about Dr. Kudo, but I don't know what he's looking for and what he talks to his patients about. But I do know that most better clinics, high reputation clinics, will have discussions at some level, be it in print or orally somehow, about the progression of your hair transplant. What happens when you have a hair transplant? You come in, you get prepped, you have the surgery, the technicians are doing this, the doctor's doing that. We'll give you these medications and those medications, and you'll feel like this for the first week, and then this like the second week, and this is what you can expect. And they always talk about how the grafts are going to shed, and they should start growing back, depending on the clinic, somewhere between some clinics will say 2 months, some will say 5 months. I usually say between 3 to 5 months is when you can expect the first signs of life regarding regrowth. And so that's why they probably didn't talk to you about this, because you weren't at that stage yet. They're just talking about what they feel you need to address your needs. You didn't share your concerns and what you're trying to achieve as far as your game plan of not having to have any sort of visible side effects that affect your appearance. So that's why they just threw out those numbers and talk to you as if you understood exactly what's going to happen. So I think that, keep talking to doctors if you want, but make sure that you explain to them what your concerns are. And you might, depending on the clinic, I think better clinics will say, you know what, maybe this isn't the right thing for you, if they know the whole story of what your concerns are and what your fears are more specifically.
Right, I understand.
All right, man.
Makes sense.
You got a lot to think about. We're not saying that you're not a candidate. We're both not. We're not physicians, but I don't think you make a candidate if you truly cannot deal with any possible downside.
Right.
Even if it's temporary.
One other thing I'd like to add. So 3 weeks ago, I started TRT. And I did notice a little bit less hair now than I did before. And so, but I've stopped taking it. I'm not going to go back into that. So my question is, will whatever hairs I lost, will those regrow when I cease the TRT therapy?
It's possible.
It's possible.
Yeah. Unknown, like maybe, but we don't know.
Yeah. But
Wow.
TRT therapy is, I find it fascinating the way TRT is marketed. The whole low T, marketing gimmick. That was a marketing person who created low T. It wasn't a doctor. It wasn't a scientist. It was a marketing person, a company that made that term low T, and they just fucking ran with it. I'm not a fan of TRT therapy if you're dealing with hair loss in general. If it's 100% necessary, you're not functioning normally, you're not able to, achieve, maintain erections, if you feel totally fucked up and tired all the time, if your T levels, if your testosterone levels are super low, I understand it. But even if they are low as far as what's supposed to be average, if you're functioning normally, that doesn't necessarily mean it's a bad thing or it's going to affect you negatively in your life. So even to base an individual's health on a baseline requirement of what testosterone should be, to me doesn't make any sense. It's really like a one-size-fits-all approach to medicine, like all these companies and practitioners try to put out there. So, yeah, I would be on that shit right away. I say that all the time. I would be jacked as hell. I'd be all juiced up if it wasn't for my hair.
Yeah, so the doctor did not prescribe testosterone. He prescribed Clomid, which is a female hormone, but it tricks the body into generating more
testosterone.
Yeah, just to let you know.
All right, man. Well, listen, good luck. I wish you the best. And
you
have
much.
a lot of decisions to make, but, just do your best. You can call again, but be informed before you move forward with anything.
Okay.
All right.
Do.
Take care.
Thank you, Spencer. Thank you, Joe, so much. Appreciate it, guys.
Okay. Bye-bye.
Yep. Good luck.
Thank you. Take care.
Phone number is 888-659-3727. That's 888-659-3727. We have a line open if you want to give us a call. We're going to take another call now. Hey, you're on the air. Who's this and where are you calling from? Hey, caller, you're on the air.
Me?
Yes, it's you.
Is it me?
Yeah.
Yes.
Cam, Austin, Texas.
Cam, what's happening?
What's up, man?
It is you. Thanks, guys. Appreciate you taking my call.
Sure.
We talked briefly on the show a year or two ago, and I was looking for a recommendation in Austin, Texas of a doctor, and I got one. And I went, and I had 3 visits to them thus far, and I feel a little disillusioned. I spent nearly $500, and all I got out of it so far is a prescription. Basically, what I'm looking to have done is I've had work done in the past from Dr. Bobby Limmer down in San Antonio, and I was real pleased with the outcome of it, and we kind of hit it off, personally, and that was a cool thing. When I first went to the doctor here in Austin, I was told that, yeah, they can do the frontal band is what I was really concerned with, because that's the most visible, obviously, and he would do it for $5,000, and I thought that was reasonable, considering. I don't know how many grafts we were talking about, but to do my temples and the frontal band would be $5,000, and that's what I was looking for. That's where I'm showing the most thinning.
Okay.
So I started taking the pills, and I went back a few months later, and I spoke to his assistant, and he took one look at me from across the way, and he said, I don't see that you need anything done, which was really nice.
Now, who is this?
But I knew I did.
Mm-hmm.
I went back the third time, and the doctor himself told me that he recommends I take this new stuff called exomes. Is that how it's pronounced?
Exosomes.
Huh?
Exosomes.
How's it?
Yeah.
Yeah. And not do any grafts. So I've gone 3 times, and I've gotten 3 different answers from the same people, and I'm a little disillusioned. So basically what I'm looking for is, in Austin, Texas, names of doctors, and where would I find that? From your website?
Well, here's the thing. You were told in a physician's office that you don't need surgery. And then you were told by another physician that you don't need surgery. You might want to try medical therapy or a newer medical
and these
treatment.
are all the same guys. That's what's confusing. I went the first time, the doctor himself told me that they can do the frontal band for $5,000.
Right.
I went the second time, and I met only with his assistant, and he's the one that told me, I don't see that you need anything.
Okay.
But gave me a prescription, said come back in a few months. I went back in a few months. I met with the doctor and the assistant, and they were trying to sell me on these. How do you pronounce it?
Exosomes, yeah. So here's the thing.
Right.
When the doctor saw you initially, he probably took a look and said, yeah, I mean, he can do a small procedure that might be helpful if that's something that you want. But the fact that the consultant had a different view and said, you know, maybe you're not a candidate, that's not such a bad thing. It's confusing, but it's not such a bad thing.
Yes.
And then they may have come back around and been like, well, we probably shouldn't perform surgery on him because it's a 50-50 chance he won't be happy with it, even if it, it could have shock loss, whatever it is. So let's try to sell him some exosomes. So at least, we can get him in the chair and make a couple of bucks.
I was doing a bit of like George you just had on a moment ago. I was doing a bit of a comb over on the frontal, letting the bang kind of go to the side and cover the temple area. So he may have seen me when I had my hair like that and had it sprayed a little bit. I don't know.
It's possible.
But basically, what I'm turning to you right now for is a couple of names in Austin, and I'll go to one that I haven't
don't have any
yet.
I have no names in Austin besides the people that you went to. You can go to there's a guy in Plano, Texas. You can check out Dr. Yaker. He can give you another assessment. See what he has to say.
Dallas.
What was that?
Joe, do you have any in your bag?
That's it. That's it. Texas is kind of dry as far as hair transplant talent, as far as I'm concerned. Austin, you went to the you went to the one you went to, and like Spencer said, Plano, Texas, Dr. Yaker, and that's about it. I would recommend that you take advantage of the internet and maybe go for some virtual consultations just as a preliminary fact-finding mission to get recommendations or opinions from multiple clinics. I suggest you look to the IHRS recommended or accepted member list just to see what some of them may say. And maybe they'll reinforce what this consultant said. You don't really need anything. You'll have a mix of opinions in there. Some will probably say surgery, but you'll start to see a pattern develop, and this can help you with your decision on what you want to do.
And if I if I'm not mistaken, you said earlier that about $5-6 a graft is what one could expect to pay.
Yeah, it depends on the region. Depends on where you are in the country, or if you decide to go out of the country, it can be lower. It can be about the same. But ultimately, like I don't really talk a lot about price because I think that that's between the clinic and the patient and what the patient's willing to pay to be in the chair of the clinic of their choice. That's what I believe. So, but on average in the States, you'll see between I'll say actually between $5 and $8 a graft if you're looking at FUE. If you're looking at FUT, then $5 a graft is probably the high end of what you'll find.
Do you recommend FUE for the frontal band? So many of them just don't survive.
Yeah, I don't recommend one procedure over the other for anything, unless it's a clear-cut case where it's a Norwood 6 and the patient wants to maximize the donor region for every graft possible over the long term. That's the only area where I would suggest perhaps it's not a blanket approach, but perhaps start with FUT first and then switch over to FUE, like I did basically. But I mean, it's a really personal approach that blanket opinions aren't the best. So, look at your priorities.
Excuse me, Jeff. Back to recommendations. I do have a second home in Palm Beach and Florida. And are any doctors in that area that you can recommend? Palm Beach,
South Florida has several doctors. Not in Palm Beach or that immediate area, but yeah, hour and a half south down in Fort Lauderdale, you got a few IAHRS accepted members. You got Dr. Bauman, and then down in Miami, you got Dr. Epstein. You got one of my favorite doctors that I work with, Dr. Aaron Nussbaum. Yeah, I mean, you got a few options down there to look at as well.
And New York City.
Again, slim pickings. Dr. Cole just opened an office there. You got who else we got up there? IAHRS accepted members. I don't work with anyone specifically in New York, but except for Dr. Cole. But you got Dr. Bernstein's office, but he'll tell you probably straight up, stop thinking about it. And then there's Dr. Carlos Wesley in New York City. I think he's exceedingly good. I think that more people should be looking at Dr. Carlos Wesley. And then a little further north in Connecticut, you got Dr. Scott Bowden, who's also kind of flying under the radar, as it were. And yeah, I mean, there are several good options in general on the East Coast.
Okay, good. Thank you very much, gentlemen. I appreciate your time.
All right, man. Good luck.
Yeah. Good luck.
Take care. Bye-bye. Phone number is 888-659-3727. Let's see who this is. Guys, we have a line open if you want to call in. Hey, you're on the air. Who's this, and where are you calling from?
Hey, guys. This is Mike from New York. I called in a while ago. I don't know if you remember me. I had a PRP session back in July and then experienced a massive shedding from that.
Yes. How you doing, Mike?
Yeah.
George, if you're listening, this guy is exactly what we're talking about. Sorry, Mike. I was talking about our first caller earlier. I don't know if you heard that guy.
Yeah, no, I heard it. I did. I actually posted in the chat, don't do it. But my situation's gotten much, much more dire. I am losing hair at a rate that is highly alarming, considering a year ago I was maintaining to a point where Dr. Bloxham didn't even want to do a transplant on me. The scalp is red and inflamed. Sometimes it's not red, but it's always inflamed, and it's itchy, burny, even in the donor area and the sides. I don't know if you remembered, but I had said I was going to go see my dermatologist, and I did. I waited 3 months and lost 3 months' worth of hair waiting to see this guy for him to shoo me out the door, which was pretty funny because he's the one who diagnosed me with male pattern baldness when I was in my 20s. As you know, I'm 42 now.
Right.
He basically told me, you have enough hair on top of your head. Stop worrying about your hair. What he did do for me was he wrote me a script for name brand Propecia, because as you know, I was on Keeps, and I wanted to switch to the name brand.
Right.
So he wrote that. He said I could also up it to 2 milligrams a day if I wanted to. And he also prescribed fluorocyanide topical steroid for the seborrheic dermatitis. He said he didn't see anything, but there was some dandruff flakes, and if it's itching, then to use this a couple times a day for a week. Well, this has not been working at all. In fact, if anything, I feel like it made it worse. At this point, I sought out a second dermatologist, and I got in with her right away. She was much better. At least she listened to me and didn't shoo me out the door and tell me I was going crazy. She said, yeah, you can try the steroid that he prescribed. She also had me, she wants me to do a full hormone panel for blood work, which I'm going for Monday. But other than that, I'm in a rock and a hard place here. I'm literally losing, guys. When I tell you, I used to when I was maintaining and holding my hair with minoxidil and the Propecia, I would lose 4 or 5 hairs in the shower. Now, every time I run my hands through my hair, there's like 20 hairs, 10 hairs, and it's not like it just stops in the shower. If I'm over the sink more, if I'm at work, it's falling out, and I'm actually starting to see. I'm kind of in the situation that guy's in, where I can style my hair to the side and hide the receding temples, but I'm seeing now a bald patch towards the back. I'm seeing the mid-scalp start to go very drastically. Like, I could just see density. You guys know how it is when you check your hair obsessively every day. You know where you were and where you are. And so I'm really panicking because I'm losing this so fast that I think if this keeps up, I could be diffusely, very visibly bald within a couple months, even though right now I can still hide it with the styling because of the length and some topic. But the fact that the scalp is so inflamed has me, concerned, and the steroid didn't work. I've tried zinc shampoos. Obviously, I've been on Nizoral 2% for the hair loss.
Now, you're the guy that went to, was it like a med spa?
Correct.
Okay.
It was an RN. She used to be an ER nurse.
Yeah.
Well, I don't know where to go from this point, guys. I'm not even sure this is related to the PRP. That was back in July. Now we're dealing with scalp inflammation as well. I found a guy online. I don't know if you ever heard of him on YouTube. He's this guy from like a Slovakian country, and this guy basically restored his hairline from like a Norwood 4 highly diffuse back to nothing. And he wrote this whole book of how you need to treat. We all target the DHT, but nobody treats the scalp health and talks about all this stuff, diet and supplements and, doing yogurt mass and all this stuff to keep the scalp inflammation and scalp health optimal for hair to grow.
Well, I do believe in doing everything you can to reduce inflammation, but I don't think it's by doing it. The things I've read online or seen online, like this guy you're talking about, that's treating symptoms. I believe in trying to find the root cause, and in your case, like you're talking about this, and first off, I got to tell you, I hate hearing this, and the reason being is twofold. One, I hate to hear about anyone going through, kind of panicking about, hair loss and not knowing what to do. But number two, I went through this exact same thing. I've talked about it a couple times on the show. I think around 2008 or so. And this was at the peak of, my online notoriety being the representative of Hassan Wong, and I had my hair up in big pompadours. And I was doing the highlights and really having fun with my hair. And then after a while, I started to notice that my scalp was beginning to itch, and I never had issues with itchy scalp. And then it started getting worse. And then I noticed, like, I'd be touching the donor area, and it would be painful, like tender.
Right.
And then I noticed large flake. You can't even call them flakes. It was like skin, like dead skin slaving off, like quarter size, like a $50.
Yeah, I'm not that bad. It's just regular.
Oh yeah, I was.
Yeah.
Yeah. Well, it can, like, that's why mine started, and it just progressed. And I was losing my shit. I was like, what in the hell is going on? And I really thought at one point, my future as a representative for a hair transplant clinic might be in jeopardy because my hair is going to look like shit. And so that started my journey. And I tried all the shampoos. I still have Nizoral. I don't use it anymore, but I still have it if I need it. But I did two things. One, I eliminated all the sugar in my diet. 100%, like
Yeah, I tried
100%.
that.
Okay, tried it, or are you still doing it?
I'm still doing it. Refined sugars. I'm eating stuff like blueberries because I heard that stuff is good for inflammation.
Okay, well, yeah, okay, simple berries and stuff like that's fine. Just don't, eat like 5 handfuls of them, in one go. But, reducing all the sugar intake and then eliminating all of the processed foods. Like, I used to eat sandwiches all the time and, of course, stack it high with ham and pastrami and all that. None of that. Can't do it. You got to cut out all processed foods. The only food you eat is
salmon.
Shit that you cook yourself, and you know where it came from. Organic, 100, no hormones, no nothing. Because you may have developed some sort of allergy to something that you're eating. And you don't know until you really get hardcore for 6 months solid, because that's how long it might take for it to for the issues to abate. However, the second thing I did was I tried a tar-based shampoo, and that was
I tried one with coal tar.
Okay, you did. And how long did you use that for?
I don't know, about a week.
Okay, yeah, you need to use it for
I tried the Nioxin with the zinc, and of course I have Nizoral 2%. I've been on it to combat hair loss forever. So I don't even know how this even cropped up with the Nizoral being there. But
well, it's because there can be different causes that one treatment might work a little bit, but not as much as another treatment. I mean, there are different ways that different treatments can work that can help your situation, but ultimately, you're talking about having a blood test done. I think, like I was thinking to myself, that's another thing that I would recommend is get some blood work done. But also, ask about running an allergen test to see if there's something in your environment that you're also allergic to. Because when you've got inflammation on your scalp or anywhere on your body and you don't know why, it's in reaction to something that you're allergic to. So you got to find out what it is. And so running the hormone panel, that's great. Running the blood panel, that's great, but also when you're doing the blood panel, see if there's some way they can start running an allergen panel as well to see if there's something in your environment or something that you're eating. That's the only other thing I can offer.
Yeah, I mean, this is so disheartening. I mean, it's scary. I'm literally watching my hair go day by day. Even when I was losing my hair since my 20s, it's like, a little bit here, it's thinning a little bit, but I'm literally watching this stuff go down the drain and in my sink and in my hands every night. Like, I had my sunroof open on my truck today, even with the top again, with its style with the top again. I was like, wow, you can start to see through, and the hairline is shot. Like, it looks like I got a fresh haircut because my hair is no longer growing to where it needs to be. It's all falling out. And a lot of the hairs that are falling out in the shower are very fine. They're miniaturized, and there are some long miniaturized and some that are vellus or terminal. But then there are a lot of short miniaturized, too, which means they're not even completing their cycles anymore.
Yeah. Here's the thing. You're in a tough spot. There's no doubt about it. It's frightening. I completely understand that, during especially at the beginning of my hair loss, that was the way that I was losing my hair. No. I do believe, though, that I know it's difficult to imagine this, and you said that you're not sure if it was because of the PRP, but I do believe it's possible that the PRP did set that off in your particular case. And
yeah, because I was maintaining very, very well up to that point. No inflammation. The last time I remember having an itchy scalp was maybe in my 20s when I first started getting hair loss, and then I got on all the drugs. Now, he switched me to Propecia from the generic, this dermatologist. Is it worth taking 2 milligrams a day? He wrote it for 2, or I read online that the efficacy doesn't really change past 1.
Yeah, you don't. All I can say is we're not physicians, but you can't believe everything you read online for the most part. Most things you can't believe. It doesn't matter where it is. It could be on WebMD, and I provide content to WebMD. But there's so much content being provided, and there's so much misinformation, I believe, on all of these resources. they're not providing the full insights that you guys need to have. So yes, I believe it can be dose dependent. The fact that your physician prescribed it, he probably believes it as well. And that's going to be up to you and your doctor to make that decision. But
I think it's good to switch not only am I switching from generic to name brand during this time, should I be upping my dose when everything else is so unstable at this point, or?
You could wait. You can see how you feel on your on 1 milligram of brand name. See how you do. I think what's ultimately going to happen is your body is just going to have to kind of reset, and your hair cycle is just going to have to reset. And right now you're in panic mode trying to throw everything at it, which I understand. That's what most people would do. But the treatment possibly just altered your hair growth cycle to a degree where it's just going to take some time to reset. It could take a year or more.
Right, that treatment was last July.
Yeah, so I mean, August, September, October, November, December, January, February, March. So you're talking about 8 months. In a month from now, all of a sudden you could be like, holy shit, my shedding has slowed down.
Yeah, it's weird though. You shouldn't by 8 months. It should have been slowing if it was caused from that. No.
No, not necessarily at all.
It feels like it's getting worse.
The whole dogma and the mantra and all the it's always like, oh, if you have telogen effluvium, within 6 months the hair will start to grow. It could be a year. It could be longer. That is just kind of like the average.
Now my question is, now that I've lost this hair and having androgenic alopecia, even if it does start to recycle, am I going to get this hair back, or is now I've lost that ground? You know what I mean?
Not necessarily. I mean, as long as the hair follicles are still pumping out hair, the rule of thumb is, if you had hair, if that hair is growing within the last 5 years, terminally, that it can be saved. Now, we don't know if that's 100%, it's going to be 100% in your case, but, the hair follicle is still alive. So
and then my other question is, I use Rogaine once at night. I use the liquid because I find it penetrates better, and also I just find the foam really wrecks my hair. But is it safe to be putting this liquid on with an inflamed scalp? I'm afraid to stop the Rogaine because I've been on it for 10-plus years. So if I stop it, that could induce a shed. But at the same time, now I'm putting Rogaine with propylene glycol on an inflamed scalp every night.
Yeah.
Yeah.
And that's a problem.
Tough.
That's a tough call, man. You may want to try to maybe get a compounded formulation of minoxidil without the propylene glycol.
You can order those online, right? There's some companies that have it without the propylene glycol.
But you just realize that it's going to be generic.
Right, but isn't the propylene glycol in there to keep it preserved and as a carrier agent? So I don't think they just put that in there to destroy your hair.
They don't put it on there to destroy your hair, but yeah, it's put in there for various reasons that aren't necessarily necessary for absorption or for the product to be preserved. It's an inexpensive, propylene glycol is used in everything. It's also a degreaser. So it's an inexpensive agent that could be added to these topical preparations, where there are other agents that can be used that may be a little bit more costly or just as effective without the same allergic reactions or inflammatory issues. So I don't think removing propylene glycol, again, I'm not a doctor, is going to diminish possible results from minoxidil. And as a matter of fact, I believe that results can be enhanced with a better vehicle.
I see. All right, so I'll look into that, propylene glycol free, I guess the generic. Yeah, I wish there was more. I tried to get a consult with Dr. Wesley, but he's hard to get a hold of, number one. He has someone that calls you back, and he doesn't even have consults now all the way for a consult, forget about the surgery, till July. And the woman said, oh, well, you could do a virtual consult where we send you an email and you send pictures of your head, and then he looks at it. And then if you want to go ahead with the surgery, you just email us back and we set it up. And I'm like, are you kidding? In my head, I'm thinking, yeah, I kind of want to meet the guy who's going to be altering my face. And also, I feel like no matter what pictures or videos I take, you kind of need to see the patient in person, see their style of loss, how good their donor area is, what condition their scalp's in.
I agree. I would agree with you 100%. But this is the nature of the game. Even the best doctors in this field, and even before COVID, this was the trend. Even back when Joe was working for a clinic for Hassan Wong, he was one of the first guys who actually, were doing these types of consultations. And speaking to patients directly online through images. There are websites that have online consultation forms, which I think is fucking disgusting, by the way. And
it's crazy to me.
Yeah.
I mean, I went to Bloxham. Bloxham meets in person, but Hassan and Wong now, do they ever come to the States, or to get work done with them, you have to go to Canada?
You got to go to Canada.
Have to go to Canada,
Yeah. So I'm looking into those three guys. The third guy I'm looking into is Newsbound, because my brother actually lives in Miami. So it would be an option to go down there.
He is a dermatologist as well. So if you were to go down there to visit, he could give his viewpoint also from a dermatological point of view.
Oh, okay.
And being a fantastic hair transplant surgeon, then he's probably in a better position to give you the most well-rounded opinion on how to approach it, because he's looking at it from both angles where he's very experienced.
Oh, yeah. All right. Maybe I have to pay him a visit. All right. Well, so basically the battle plan then is cut out sugar, which I've done. I'm trying to change diet. I'm eating salmon and chicken mostly. I'm trying to stay away from fried shit, processed stuff. I've stopped with the topical steroid because I feel like it's making things worse.
Let me ask you a question. I don't think we ever asked you this. How would you feel if you just trimmed your hair down really short while you went through this process?
Well, you feel that would help?
No. I don't think it's going to help the hair growth process, but I think it can definitely help you emotionally, not seeing hair shedding all the time.
The problem is, if I buzz my hair down, I think it would give me more anxiety at this point, because it's being hidden by the layering of the length. You know what I'm saying?
Yeah. No, I do. I understand that. But so
I used to rock a shaved head for a long time, actually, and
really,
I did not like it. Yeah.
How long did you rock it for?
7 years, 6 years.
All right. So you used to shave your head for 7 years. You lived your life with a shaved head for 7 years. Now is the time to shave your head or cut it very close while you're going through this process, because you can try to let it grow in 6 months, and you could all of a sudden be like, okay, my hair's growing back. Finally, I'm back on track. But if you lived your life for 7 years without hair, holy shit, you already beat this thing, man.
No, but I was always very self-conscious of it. I wore hats all the time. It was just, I tried to approach it from that point. I was still using the topicals while I had my head shaved. There was still there was the stubble up there, obviously, but I could see where it was receding and stuff. And then one day I'm like, you know what, let me try to grow it and see where I'm at. And honestly, it was pretty good. And that was probably within the last 2 or 3 years. 3 years, I would say. I started growing it. First I was kind of doing like a little faux hawk where I shaved the sides and just did the top, and then I let it all grow out, and I was doing really great.
But here's the thing, you've already experienced that. You lived that way for 7 years. If there was any time to make that happen for yourself again, now would be the time. You've already lived that life.
You mean in terms of stress, or in terms of it's going to help with the scalp situation?
As far as stress, as far as potentially helping with the scalp situation, as far as just not happily won't matter, but it's possible. I mean, you don't know. I mean, it's possible that, especially if you're going to apply some medication to your scalp, or if you're going to be using, I don't know. I mean, it's unlikely that having hair in your head. I mean, you're using Topic, right? You said fibers.
Topic, yeah.
Yeah, I mean, so if you choose not to use any of that stuff on your scalp, it may help heal things up more rapidly. It may give your scalp the ability to breathe a little bit more, not have contact with these chemicals, because
right, and then I'm not using hairspray.
And you're not using hairspray, all that stuff.
Yeah. It's very disheartening because I had my head shaved, but I live my life mostly in a hat, and
well, so do that for another 6
I was so happy
months.
that these past couple of years I had a presentable head of hair. It was very again easy to style. I could even put like a pomade in it, and now I can't do that. If I put a pomade in, it just looks like garbage. So I have to literally get out of the shower. I mean, it's like, like Spencer, you talk about. It's like a magic show up there. It's all smoke and mirrors.
How dare you?
I got to comb it a certain way. I got to blow dry it because that makes it look thicker than it is. I put in the topic. I have to, use a coarse hair comb. You can't use a comb that's too fine because it'll chop it up. So it's a whole smoke and mirrors show up there.
Yeah.
It's getting harder by the day.
Yeah, well, I mean, that's life, sadly. Life is getting harder by the day, man. But yeah, I get you completely. I'm just like, in my mind, if I lived at some point in my life with a shaved head, I would go back to that. If you were able to maintain a life and live your life and work and socialize and all the stuff, even if you wore a hat, whatever it is, but if you were still okay for 7 years of your life, now is the time to give that a shot again.
Yeah, I mean, I feel I was a lot younger then. I was in better shape. I could rock it better,
All right, so get back into shape. Take this next 6 months, shave your fucking head. Take the next 6 months to get jacked.
Yeah, I could do that. Do that.
Instead of worrying about this, instead of stressing the way that you're stressing right now, and really you're losing these years of your. How old are you now?
I'm going to be 43 in July.
Okay, losing this year of your life. And which could be or losing another year of your life, just waiting for the hair to grow in. You could decide to focus on something else, especially since you've already shaved your head. Now, if you never shaved your head, if you're a guy like me, that would be a very difficult thing to advise. But you did it already. So, in my view, shave your head or cut it really short. Stop putting the chemicals on your hair like hairspray and Topic and all that stuff for a while so that your scalp can clear up. And concentrate on going to the gym, get jacked again.
Right.
And focus on something that could be very positive for your life. And then in 6 months, you could say, let me try to grow my hair out. And all of a sudden, holy shit, my hair's back.
Okay. And as far as the Wesley thing, you think demand to pretty much definitely meet in person, right? I mean, what's the point of doing an online consult type of thing?
I would say you don't even to even think about having surgery at this point is ridiculous.
Yep.
So if you can't get in touch with Carlos, then I would say maybe it's a godsend right now because you should not be considering surgery, especially since A, you could always shave your head because you've already done it. B, no matter how much you think you want hair, it's going to be a lot more fucked up to have issues from surgery. So you have to 100%. really be ready. Like, okay, this is it. I'm committed to this, to having hair on my head for the rest of my life because I'm going to be cut.
Well, the reason I thought about Wesley actually was because I started dating a girl whose brother got 2 hair transplants from him, and it looks fantastic.
Yeah, he's good. Yeah. He has a great staff. He does really good work. He's a solid hair transplant surgeon. This is what he does. Mm-hmm. But you're making a commitment now. You have an option that you didn't even tell us about at the beginning or even the last phone call.
No, I know, Spencer. I know. I said, but I've come to the point where at this age, my style, everything has evolved differently, and I like having the hair. Like it frames the face.
Of course.
I like not having to be self-conscious and wearing a hat 24/7, or you date a girl and it's like, okay, now I got to wear a hat on my date, and then when I take the hat off, you know what I mean? Like,
yeah,
it's.
I would like it if my comb over didn't flap in the wind. I would love that. That's not going to happen.
Yeah, but I mean, your comb over is working pretty good for you. It's a thick comb over. You got thick hair there.
Well, thank you, but I would prefer that not to be the case, but that is the case. You have options, man. So I'm just telling you, a hair transplant could be the worst thing for you at this stage, especially in the mindset that you're in. You're in a panic mode, man. Not the time to have surgery.
And I look at it like this: like when you look at your, would you say your sister's boyfriend or your friend's brother or something that went to Carlos and had 2 surgeries?
It's her brother. The girl I'm dating is her brother. He had 2 surgeries from Wesley.
Yeah, so the reason why it looks great is it's not just because Carlos is a really good hair transplant surgeon. It's because he presented as a patient that had a good donor supply and didn't have any issues going into it. And you got to look at hair transplant. I hate saying it like this, but you got to look at hair transplant surgeons like an artist, and you as the patient, you're the canvas. And if you come in as a canvas that's all beat to shit and you got problems, then it's going to affect the final product that the artist is going to be able to crank out. And I look at guys like you, and what you're saying, and then George, the guy that called earlier, it makes me think about hair transplant class number 1, the very first class video I put out. Don't have a hair transplant, and in that video, I'm talking about you. If you can't handle the chance that the surgery might wind up worse than, put you in a position where you're worse now, don't get a hair transplant, because that could really happen. It happens all the time.
I know.
Every day.
I know.
Every day there are guys walking out of their surgery not realizing that they just made a big fucking mistake. And 8 months from now, they're contacting me. Yeah, every doctor on the planet, if they've been doing this long enough to be considered to be a top doctor, they have patients that wish they didn't go to them. Every single one of them.
Wow.
I'll put it like this: if they don't have unhappy patients, they've not been performing hair transplants very long.
Right. No, I know.
That's
you
just a
can
fact.
even look at doctors' results, and you see one, you're like, oh, that looks great. And then you scroll to the next page and see another and be like, wow, I'd be really dissatisfied if I paid $20,000 for that.
Yeah, but what you talking about on their websites?
Yeah.
Yeah, see, that tells me, like, that's their perspective, though. The patient agreed to have their photos used for the clinic gallery, so that means they're happy.
Right.
And it means that the result is based on not just their donor supply, but what they agreed to with the doctor, and the doctor had to make concessions. Like most people, not most people, but some people, when they look at these hair transplant galleries and they see some guy that was bald as F, and then he gets, maybe 2-3 procedures. Even in my case, I was bald as F and a repair patient, and I had a guy comment in the YouTube section today. He's like, whoever you went to, don't they know how to do temples? Why didn't you get your temples done? It's like, seriously?
Right, because you didn't have enough by that point. Yeah.
I didn't have enough. I don't have enough hair for a low hairline that satisfy the rule of thirds.
I have to tell you,
my temple points are completely reconstructed.
Most people are such fucking assholes. I just got to tell you that, man. It's unbelievable.
Yeah, they are.
It
doesn't bother me.
But you went through all these surgeries. I bet you still feel better having the hair you have now than if you were slick bald. No, Joe?
If I knew when I was 22 years old what I would be going through to get what I have now, I wouldn't have had a hair transplant to begin with. I would be a head shaver. Nope.
Wow.
Nope. I don't regret it. Like I'm glad I went through it. But if I was able to talk to my 22-year-old self today and explain to me what I've been through, nope. I'd be a head shaver. Like I couldn't shave my head back in '92 because then I'm a skinhead. And back in the early '90s, if you were shaving your head, you were a skinhead. Like there was no in between.
No, yeah, I remember. Yeah, I remember that. Yeah.
And, but yeah, if it was 10 years later, not a problem. Shave my head.
And it's true. It's 2022, and we have no good solution for this. We don't have hair cloning. I've been hearing since I was in my 20s. It's 5 years away. Every year, it's 5 years away.
It's been 5 years away for 50 years.
Yeah, I know. A hair system is not ideal because that comes with its own set of problems. And then a hair transplant is great for a guy who's receded and has thick hair and he's never going to lose any more. But other than that, if you're going to be a Norwood 7, you're a diffuse thinner, I mean, that's not really a great solution either. So it's disheartening that at 2022 we still have no advances besides a pill and some potion you put on your scalp.
They're making some good wigs now, though. I'll tell you that.
No, I know, but that's a whole other problem, I had a client who wore one of those wigs, and he told me, he's like, listen, man, it's not as easy as you think it's going to be. You sweat under it. Your scalp gets really nasty. You have to know how to glue it down if the hairline starts to come up when you're out.
Well, that's where you get Botox to kill the sweat glands. Just kidding. Just kidding. Just kidding.
The reality is you can't go to one of these service places. You can't leave that shit on your head for 6 weeks. You have to be able to remove it, every few days in order to make sure that there's no funkiness or whatever under the scalp. It is a tremendous amount of effort for someone to do it right. You see these guys who are doing it it's becoming more acceptable now. You see these TikTokers and people who are doing it and doing it themselves, and you see how great it could look, but they are maintaining it in a way that most people they don't have the patience, the time, the artistic ability. They can't nuance it. So yes, you're absolutely right. But because most people end up going to these service places and they're like, yeah, cut back in 6 weeks, and you take that shit off in 6 weeks. I can't even imagine what that smells like.
Oh yeah, he said it smelled horrible. It smelled like a dirty wet sock.
Yeah.
I knew someone that used to wear a system, and I can attest to the fact that it's pretty rank once it comes off after a month or 6 weeks. Jesus.
Yeah, and he said
It's
the other
bad.
problem is as you get closer to that date to go back in, the system starts to become loose on your head.
It can, yeah.
Well, that's the point. You can't. That's why I tell anyone who's going in this direction, they got to do it online. They have to learn how to do it themselves. You can't go to these service places. You can't do it.
And it's not easy to do yourself.
Well, it's something that if someone is committed to it, they can learn, or they can find a local barber to help them. There are ways. However, that's a fucking pain in the balls, but it's an option for some people, and for a lot more people than you realize, because it's right now it's the more money is spent on artificial hair than in all these other treatments.
Mm-hmm. Even surgery.
Oh yeah, absolutely.
Interesting. All right. Well, thank you for your time, guys. I guess I'll keep you updated.
All right, man.
All right.
Listen, good luck. I hope
All right,
the phone call helped. Take care.
Thank you. I appreciate it.
Bye-bye.
All right, bye.
Take care.
Take care.
The phone number is 888-659-3727. That's 888-659-3727. He's getting a hair
Shaved his
transplant.
head for 7 years. Shaved his head for 7 years.
Yeah. 7 years.
Failed to present that little nugget of information.
You know how much time we could have saved, yo?
Jesus. Go check out my boy Harry over at Bald Cafe. That'll help you get kind of transitioned into the head shaving thing again.
At least temporarily, man.
At least temporarily.
Let's take a call. Hey, you're on the air. Who's this and where are you calling from?
This is Ryan. I'm calling from Tennessee.
Hey, Ryan. How are you, man?
Ryan. What part of Tennessee?
Good. It's good. I escaped at Los Angeles, so I just arrived here 2 months ago. So I know your guys' pain.
Good.
Where'd you move to? Nashville?
Chattanooga.
Oh, okay. All right.
Man. You're in you're in Freeville, man.
Yes, I am, and I got to tell you, it's a welcomed respite from Los Angeles. I just got out of there. I lived in Sherman Oaks for a long time, so I'm glad I'm gone.
You know what I mean? At least you were living in a house, obviously, in Sherman Oaks?
I was living in a resort-style apartment building. It was really nice, but still, I just couldn't handle it. I couldn't handle Los Angeles anymore, man. I'd spent 20 years there. I went to USC. I got done. I just couldn't do it anymore. It's just too crazy.
It is a different world now, man. You know, I'm kind of like...
now you're a volunteer.
I'm kind of like in a weird little bubble, and I guess I'm fortunate in that respect, but still, once I kind of walk out of that bubble, you just like... You know, it's like escape from LA. It's like, what the fuck is going on here, man?
Yeah, it was. I went back and got rid of the apartment, but it's also just the cost of it and just the freedom. I mean, I'm just scared that it's going to get locked down again, and I didn't want to do it anymore. I was like, I'm done with it.
I don't think it's going to get locked down. We're about to enter World War III. Everything's going to change, man. You know?
Yeah, we'll just have to escape the missiles.
We'll be doing the fucking bald truth through fucking shortwave.
You guys will be in a bunker with a satellite antenna.
Yeah.
Oh my God.
Well, anyway, guys,
take your iodine pills.
I really, I really appreciate your guys' show. I've been listening for a long time. I've watched a lot of the videos, and it's hard to find. There's so much information. I'll give you guys the breakdown because I don't want to waste a lot of time, especially. And I appreciate what that last caller was talking about too. I'm 40 years old, about a Norwood 3. Been on finasteride off and on for about 10 years. Minoxidil 5% for about 25 years. I started losing my hair when I was 15. Microneedling once a week, 1.5. I've narrowed down the hair transplant to basically Dr. Cole. After listening through you guys, doing all my research, he says I need about 3,000 grafts. I can do them over 2 surgeries, $8 a graft. He's got all this stuff like A-cell stuff, which he's got all these other add-ons. So I've got a few questions. I thought that since you guys, know him so well, one of the things that bothers me is that he does the extractions, but he doesn't do the placement. So should that really bother me, or should I be kind of like, because there's a lot of doctors that will do both,
Who's a lot? Name 10 who will do both extractions and placement.
Yeah. I don't have them off the top of my head.
Yeah, because they don't exist. There's a few. There's a small handful. The way this industry it was developed is that technicians in general always did most of the placement, if not all, graft placement. So that should not be a minus in your equation when you're deciding on who to go to. It's a absolute plus that Dr. Cole is doing the incisions and the extractions of the graft. So that's what you have to think about.
And I'll explain it to you how I. Let me explain to you a little bit more on that. Like, the placement of grafts, it is very delicate work, but the only thing that really matters in this situation is when the grafts are placed, they're placed into incisions that actually dictate the angle and direction of the growth. So once they're placed in, it's the incision that dictates the final outcome, assuming that they're not damaged when they're being placed in. But of course, a top clinic won't have technicians that are routinely damaging grafts. So the question you need to ask yourself is, what led you to Dr. Cole? Was it the results that you saw on his website and the various outlets where his results are shown? Well, every one of those were performed where he makes the incisions, technicians place the grafts. So it's nothing that you haven't seen already. You're just learning about how it was done. So that's what you can expect for your own procedure.
That's a really good point. Okay. And then my other thing is the cost is obviously, it's about $28,000 to do 3K grafts with all the other stuff, the CRP, the ATP. Should I do all these other side things that are about, I don't know, I added it up. I think it's about $5,000 extra to do this CRP, ATP.
I gotta tell you, I'm just going to say this. Maybe John's listening, but you think about the amount of money that these guys are able to command for their hair transplants, and it's like there's always some sort of issue when it comes to membership dues for organizations. What the fuck? Joe didn't even hear that. Joe's not even paying attention.
No, someone in the chat room is talking about someone transitioning. Oh, God. Not sure they're talking about. Sorry, what'd you say?
Another reason why I escaped LA.
Oh, my God. Look, I was hanging out the other night. Probably shouldn't have been. Just getting loaded, telling tall tales, having fun, bunch of strangers. All the happy horse shit. But I'm hanging out with these kids. Like, one kid is like 30, and like every motherfucker in this town is either an influencer or he's involved in a startup.
Yeah.
It's nuts. That's all they care about. Like, there's no, it's almost like humanity has disappeared from Los Angeles. No one talks about anything except for fucking business or bullshit.
Yeah. Yeah. Well, I grew up in Orange County. I grew up in Dana Point, which is like paradise.
Yes.
And when I went up to go to USC, I don't know. LA, I wouldn't consider it wasn't a small town, but it definitely had a lot more moral character, and you felt that people were trying to build businesses and build families. And I agree with you. Now, like, this place is just a shithole, man. These people don't give a fuck about anybody.
No.
So I feel you. I feel you on that.
Well, but to get back to what you're saying about, making your decisions, again, very difficult to find someone who's placing their own grafts. Even if they are placing their own grafts, there are some, depending how old they are, if they're older, by the time they're placing the grafts, they're already fucking tired, man. They have their glasses with their triple loops and their fingers are all fucked up. You want people who are nimble and who do this on a day-to-day basis. And honestly, the younger the better, in my view. People who really have better eyes, who have really strong eye-hand coordination. When I see a 60-year-old guy sitting there placing all his grafts, sometimes I'm like, I wonder how that's going to turn out. So I don't think anyone really puts that into consideration, because you hear all this fucking bullshit online, or other organizations who are like, it's got to be a doctor doing this or got to be a doctor doing that. As long as it's legal and the team is good and has worked with that doctor for a while, then you're probably going to be in good shape.
Okay. And regarding the three other things, the ACell and the ATP and the CRP, do you think I should go ahead and do those too? Because you said those are optional. It's not like you have to do that, but it's an extra. It's $5,000. So I just was wondering, like, it sounds like, PRP, it's his own concoction. I've done my own research on PRP, and it's sort of, nobody really knows what the hell. Like, some people are like, yeah, it works perfectly.
If you can negotiate him throwing it in, then why not? But if it's something that is going to affect, it's going to make your life more difficult because of the cost, and we're not sure, the results are questionable because we really don't, you're getting grafts moved. So how much more hair is it going to grow your hair? 50% faster or more grafts going to grow, less graft? You don't fucking know. Joe?
Yeah.
I think that for many, many years, top clinics were producing excellent results consistently without any of that bullshit. Zero. The grafts would be taken out, and after they're prepped under a stereoscopic dissecting microscope, they're placed into a dish that's filled with chilled saline solution at 4 degrees Celsius. That was it. Now, the introduction of ATP, if he's talking about ATP as a storage solution, I do believe that's beneficial because it helps to extend the viability of grafts if it's going to be a long surgery. PRP can be beneficial. I don't know what the other thing is that you're talking about, this CR whatever.
CRP. One of them was CRP, and the other one's ACell 200 milligrams. I don't know what ACell is. I got to research that.
Well, ACell is an extracellular matrix that helps to encourage faster healing, less scarring from wounding, and supposedly there are a lot of claims with it. But the bottom line is, I think that if the surgery is performed properly, then there's really no need for any of these things. And if it's offered as an option, then use your judgment. Because I think that any clinic that feels like these things are necessary, they would incorporate them into the procedure to make sure that the ultimate outcome's reached.
Into the price of the procedure. I believe that if anyone says that it is optional, then why do it?
It's optional.
It's optional.
That's a good point.
Because they want to see they want to make sure that their surgeries turn out great. They don't want anybody unhappy out there, or for you to go online and fuck them up.
Yeah.
Yeah.
And don't and I don't want there to be any misunderstanding. I love Dr. Cole to death. I think he's
awesome.
He's obviously supremely talented at what he does. He knows his shit. Like he's really into this regenerative medicine stuff as well. But I just feel like if something is going to absolutely, no question, help a procedure become the ultimate procedure for that patient, it should be included on some level. It shouldn't be optional. Because if it's optional, then why even mention it?
It's like these companies are offering different tiers in surgery, not just different tiers because of their different doctors, but different tiers of the type of procedure they're going to perform, within the FUE categories, and it's like, it makes no fucking sense to me. You want to perform the best possible surgery, period. The tier thing is really just a way to make more money. This is a business. There's nothing wrong with making money. I love money. Everybody does. But people have to understand what they're getting into. If they want the extra, to spend the extra money. It's like when you go to an orthodontist. You're getting and I went to an adult orthodontist. And they want to sell you all this, this other crap, like to help, this thing that shakes your teeth at night to help move it fast or whatever it is. You don't need any of that stuff. And that's like $900. And I asked this lady, I'm like, so really, do you really think it's going to improve my results? Well, studies have shown that, it could help the movement a little bit faster. Oh, you know what? You got 2 studies and you're selling this for $900. I'm not convinced. And that's just the way I feel about it all. Your surgery will be great without any of these ancillary things. And it's possible the ancillary things could help, your native hair, shit like that. I mean, also, they may help the grafts. I'm not 100% sure. But for many, many years, they've been doing great surgery without any of this shit.
Yeah.
So think about that.
Okay, one last question, guys, and I guess this is the overall big one, is that, I've been wanting to get a transplant for a long time. I've been dealing with hair loss, as you guys know, is just psychologically, imagine being like 22, as you guys were dealing with that, and now I'm 40, and I'm like, okay, finally have the money to do this. But I guess the overall question is, should I wait?
How's your life now?
I get laid. I have no problem with that.
All right.
Still good. I'm still single. I've escaped a lot of the bullshit.
Okay.
But it's not bad. It's just part of me feels like, well, maybe I should wait another 5 years and hope that whatever crazy concoction, or if the world ends, I don't really give a shit what my hair happens. Happens to my hair. But
if you're not desperate, and you don't sound desperate, and if you're able to live your life for all these years, and you're not a shut-in, and you're not a what are those people who
recluse?
Not a recluse. There's a whole group of guys, incels. What are they?
Hermits.
No, like incels. I think they're called. Like they basically
the men that go their own way.
Well, yeah, like they can't. They feel like they're rejected from women, or that there's no choice for them. They can't have sex or something. What do they call? What do they call themselves? A whole group of people. But anyway, it's like a whole movement. If you're living life, if you have a social life, if you could feel comfortable in your own skin when you look at yourself in the mirror, or when you're out on a date, if you are getting laid and you don't feel that it's diminished your options, then I would say spend that money on a fucking car or a house or whatever, and move on and wait.
And being in Chattanooga, you can buy a house for $30,000.
You can at least get a nice trailer set up.
I wish, man. It's getting pricey out here.
Yeah.
Thank you guys so much. I really appreciate it as always. Keep up the good fight. You guys do amazing work, and we're all listening. We're all learning. So I really appreciate it. Thank you again.
I appreciate it, man. Good luck.
Thanks
Take
for that.
care.
Take care, guys.
Bye-bye.
Talk to you soon. Bye.
Phone number is 888-659-3727. It's always the whole story before they're like, yeah, but I'm cool. I get laid. I got no problem with that.
Yeah. And then they want to maybe fuck it up with a hair transplant.
Yeah. Jesus.
Who knows? Maybe his look as a Norwood 3 actually suits him better than being a Norwood 2.
Yeah. I've seen that, actually.
Know.
I've seen guys who've gotten work done, good work done. And then you're just kind of like, I know it's subjective, but I was like, oh, they actually look better with less hair.
Yeah. I've seen guys that have had an outstanding result. Thick, beautiful temples, looks like they're 20 years old again, and they didn't like it, and it screwed up their confidence. Completely turned everything around for the worse.
For the worse.
Yeah.
It's a fucked up situation. Let's see who this is. Hey, you're on the air. Who's this, and where are you calling from?
It's Morty from Brooklyn.
Morty
from Brooklyn.
Guys?
What's up, buddy?
What's happening?
Not much, guys. How are you guys doing? I'm good. Life is
terrible.
good. just coming back. No, why should things be terrible?
I don't know. We're you know,
World War III.
We're about to enter World War III. We actually are there. No one wants to talk about it.
Yeah, well, there is that. Do I want to talk about World War III? I don't think so, man. Do you really want to talk about World War III?
No, I'm saying nobody who is talking to us as a country, as citizens of this great country, wants to really provide that information to us.
And no one's calling in to ask what they do when their hair falls out from radiation fallout. Like,
right.
Well, yeah, that was quite a scare, wasn't it? That's true.
Yeah.
You know, a plant which has 7 times more nuclear fissile material than Chernobyl does. So yeah, that's a bit scary. Or
Dude,
to say
shit is getting real, and you know, I just want to kind of like be driving, see the flash, and then it's gone, and that's it.
Yep.
Lights out.
Well, I mean, you and I remember the 1970s and the 1980s, and so this is old ground for you and me.
Hey, I was one of those kids that
some of the millennials.
we had to drop down under a desk, man, and I was even as a kid I thought, how the fuck is this going to help? You know?
Yeah, that's where it started.
Yeah.
That's where it started.
Frightened the hell out of me.
How is this going to help?
But it frightened the hell out of all the kids. Are like, besides my being terrorized by the possibility of having to learn the metric system when I was 10 years old.
All right.
Yeah.
Oh
Jesus.
man! No, I remember those days, man. I remember my little. I played this gag on my little sister where I said, "Oh, you didn't watch the news? The bombs are on their way."
Oh my God!
Me and my cousin ran that joke on her for a good 20 minutes.
Oh my God! Meanwhile, she's shitting her pants and hiding under a desk.
Yeah. No wonder she hates my guts these days.
I'll just say, yeah, no kidding, exactly. I did same stuff like that with my older sister, but I'll just say this: like everyone's talking about the moves that are being made in Europe right now, and how it's mimicking what happened in 1939. That's not it. Look at 1941. That's when the U.S. Actually entered into World War II, and it wasn't because of a land grab. It was because we implied we cut off oil supply to Japan. That's why we got in the war. Yep. It was all about sanctions. So they were back in the corner, they had no choice. So that's what makes me nervous about this is sanctions. You know, they are what they are, but once someone's, that's already in a position of feeling cornered is left with even less options, shit could get real fast. Just saying.
I mean, here's the thing that's kind of bugging me, and this is only true because we're in the world of social media, is all of those people out there who feel they need to let everyone know how they feel about X, Y, and Z issues are out there putting these Ukrainian flags and saying, we stand behind the Ukrainians. Like, no, you don't. Come on. Tell the truth.
Yeah.
You don't stand behind the Ukrainians. All right? You don't. Because if you did, we would be doing a lot more than we are. But it's okay. We can virtue signal and we can say, oh, yes, we stand behind the Ukrainians. Like, no. Be honest. You don't stand behind the Ukrainians. Stop begging them on.
Well, I did choose Finlandia the other night, so I just couldn't bring myself to having the schmear off.
Don't get me wrong. I think that Zelensky is brave, but and what I'm going to say is going to be incredibly unpopular. I think that if he really truly cared about his country, he'd fucking wave with the white flag because he ain't winning this. You know.
Well, you know what?
I know it's not very heroic, but
it is not. It's not very heroic, and it's not popular. But I certainly understand where you're coming from.
Yeah. If we aren't going to get our if we're not going to put our hands, if we're not going to bleed, why should we ask somebody else to bleed for us? That's the way I see this.
Yeah. The way I look at it, though, is even if he did wave the white flag, the citizenry wouldn't because. You'd have the invading forces rolling in, and taking control of the country because that's what they're trying to do.
What do you think? There's gonna be
wouldn't have it.
There's gonna be like France in World War II. That's just not gonna happen, man.
Yeah, it's not going to happen.
People aren't going to be
It's a little
occupied.
late for that. I mean, let's put it this way: it's a little late for that. You know what I'm saying?
There'll be insurgencies left and right for the next 20 years.
Well, yeah, it like I said, it just breaks my heart because, fuck, man, you know, I don't even want to get into it. That's not why I called anyway. So, I called because
Patrick Foley's upset, though. I'll tell you that.
Yeah, Patrick Foley's going to time out.
Oh no. Oh, the reason I called was because there was an ad by a certain New York hair transplant surgeon who is quite famous on Instagram. He put a help wanted ad on his YouTube for a hair transplant tech.
I meant to respond to you. I saw you send that email.
And I'm like, okay, what the fuck is this? That was my first instinct. And my second instinct was to say, he's offering $40 an hour in New York City.
Yeah.
Now, and you and me know that that's not full-time $40 an hour. I don't care how much work he gets. He doesn't have 40 hours a week worth of hair transplant surgery for a tech. I mean, maybe he does, but...
Well, he also doesn't do hair transplants full-time. He's doing plastic surgery as well. He's doing a lot of plastic surgery.
Yeah. So, you know, for me, it's like I was really suspicious when I read it because what kind of talent are you going to get in New York City for $40 an hour?
You're gonna get plenty of traveling tech talent.
Yeah.
Really?
Yeah.
As long as they get their travel covered, but I mean that doesn't sound like it's included.
Why don't you ask? Why don't you apply for the job? Find out.
Well, because I don't have. First of all, I'm not a med tech, and second of all, I don't have hair transplant experience.
You don't need any hair. You don't need no experience necessary.
It's not what the ad says.
Based on what I've seen, I've seen lately, that looks to be the case.
It's not maybe not be what the ad says, but if you walked in there and say, "Look, this is a big part of my life. I really like to learn. I'll train for free." And then if you think that my skill sets are okay, then we can start the $40 an hour.
Yeah, the funny thing was I looked at some of the comments, and one of the comments sounded like me, a typical New Yorker, saying $40 an hour for somebody who's going to be cutting into somebody else's head, because you and I know what techs do.
Yes.
He's like, well, his answer was $40 an hour is double the going rate for this job, and that really shocked me.
Well, things have changed a lot in the industry, and I can tell you that there are people who are paid by the procedure, there are people who are paid by the hour, and there are people who are paid on salary, depending on how things are set up. The vast majority of traveling technicians are usually paid by the procedure. So traveling tech can get, there are some technicians that are making $400,000 a year.
Yeah.
I had a whole conversation with our undercover doc about that, and he's like, well, maybe I should become a fucking technician.
Well, that's the thing. I mean, if you're talking $40 an hour, 40 hours a week, you're only talking $83,000 a year.
Right.
It's nowhere near $400,000.
That is correct. But if you have somebody who's really busy, who's good, who's in demand, who gets a percentage of the case, they can make a lot of money. And there are techs out there that do that. Now, the patients don't know what the fuck is going on. The patients go there and they think that person's there every day. They have no idea. They just flew in from fucking Ohio and they were drinking all night at the at the Mandarin Oriental.
Yeah, that's the way it works.
Yeah.
So,
I'm sure. Yeah, I mean, like I said, to me, if I were a New York hair transplant doctor with a huge Instagram following, why I would put up an ad and advertise a rate to people who are clearly in New York, I don't necessarily know that would inspire a whole lot of confidence.
Well, here's the thing. It doesn't make a difference. He's first of all, he's a very nice, I just want to put this out there. He's a very nice guy. And I actually, I would actually like to put out an apology. A few weeks ago, I had mentioned something, maybe out of a little frustration, that, there's a doctor out there that, hasn't had a lot of time on tissue. It's getting a lot of attention, this and that, and that it's possible that he hasn't learned as much as a lot of some of the older guys with time on tissue has forgotten. With that said, I want to apologize about that because I thought about that. He's a super nice guy. I think his intentions are good. And I think that it appears to me like he has a kind of a natural skill set, and an understanding of the procedure. Don't look at me like that, Joe.
I'm not. I know nothing. I see nothing.
I'm not making any recommendations. I'm just saying I think there's a level of ability that can absolutely evolve. That's all I'm saying.
Yeah.
Mm-hmm.
Well, and I think your last caller, you talked
I'm
about
trying to be nice.
caller
I'm trying to be
in terms
nice
of-
here. He didn't contact me. No one's like, you should apologize to this guy. But I thought about it, and that's just the type of person I am. And I think it's, it would be disingenuous of me just to put something out there like that without saying, you know what, maybe this guy can do some good work. Maybe this guy.
You're right. You're right. Niceness trumps mediocre results every time. But the doctor was nice. He's a nice guy.
That's not what I'm saying. But I can tell you what, he does a good fucking video.
He makes a good fucking
The
video.
guy makes a
that's
good
for sure.
fucking video, and he's really fucking crushing it on YouTube.
He is.
Oh, there's no question about it. And one can
I
argue
will
that's part of
say
the
that.
problem.
He's got an amazing social media team that's killing it for him on Insta and YouTube. So
I have to say,
God bless them.
the way that he relates to the camera is very special. I don't think most physicians in this industry really have that type of connection with the camera. So that's pretty powerful. Anyway.
Look, I like watching his videos also. That's how I found this thing.
Yeah.
But I got to tell you, I mean, based on the advice that I got from you guys, you want somebody who's got, A, a lot of time on tissue, and B, is doing it fairly regularly.
Yes.
We've already talked about the fact that hair transplant is only one of many things that he does. And probably I don't think he does maybe more than one or two of those a week. Okay? Would you rather have that, or would you rather have somebody that does 5 a week?
Well, it's only been for about 3 years. So
that's another thing, right?
So that's important to factor in. Now, with that said, I think he has enough time on tissue to, potentially be like an associate member of the IHRS and to kind of get involved with the educational process and be involved with what we're doing. But yeah, man, what can I tell you? You listen to the show. You know what you're talking about now, Morty.
Yeah, and to me, that's the thing. The choices that you want to make, and by the way, I remember asking that very same question of you not too long ago about do you have diminishing returns if you've got a 60-year-old guy on tissue? I was asking you about a certain doctor in Sarasota, and and you got all defensive over him because of the fact that he was over 60.
How dare you say I got defensive?
I was waiting for that one. That's good.
I think that all of these things
was that
doctor
was that doctor over 60 actually performing surgery on you?
No, but he was one of the doctors that I saw for PRP.
Okay, so do you think?
You remember the one who isn't even really a doctor? That guy?
So I'm pretty sure though that he was more than capable of injecting your scalp with PRP.
Well, yeah, but that's not what I asked about. I asked about surgery at the time, and and we were talking about.
Let me tell you something. Do not take Morty to court, man. Whatever you do, do not ever take this motherfucker to court and let him try to fucking sit and defend your ass.
Dude, I can't help it. It's my bloodline. You know how that works.
Jesus Christ.
What I was going to say was, though, again, to bring it back, is that you want to make sure that you've got somebody who's got good time on tissue, but you also want to make sure that they're not past their prime.
Dude, here's what you do. You say, "Do me a favor, Doc. Hold your hands out." If the hands don't shake, ask him. Check out his gait. Ask him to walk around the room a couple of times. And that's it. If he's okay, then he could do it. I know a guy here in Los Angeles that has to stand on a fucking ladder to work. Okay?
Oh.
And he's still doing surgery.
I also know a guy who fell asleep in his. I also know a guy who fell asleep in his soup, and I ended up letting him cut into my head. So there you go.
You see, do not take this guy to court. Now the guy who fell asleep in his soup is going to hear this.
Yeah.
Fucking guy, physician nodding out.
That's good. That's good.
Now, did he actually fall in? Did he actually fall into the soup?
No. But he was definitely out. Now, granted, we're talking about a dinner at 9, 10 p.m. in the evening, not surrounded by his techs. So
9, 10 p.m. in the evening.
Time he was.
What is he?
Yeah, we were late.
110 years old. He can't eat at 9 until he falls asleep he falls asleep with a spoon in his mouth at 9 o'clock in the evening.
It was on the table. It was on the table, and he had a long night the night before. That was when his son had to fly to a certain place to help another friend of his.
I gotta tell you, dude, you are not one to keep a secret.
Well, this wasn't a secret because we were talking about the same shit like fucking 6 months ago.
Yeah,
it was more like a year ago. But none of this is secret. Anyway,
we're gonna call you Morty the Yenta from now on.
Well, again, look at my bloodline. What do you want?
Yeah, I hear you.
But I think it's important that you have to you buy the whole package when you're getting a doctor, right? You want to make sure that they're smart enough, that they've got enough time on tissue, that they're healthy enough to get through the surgery, that they're meticulous enough to do a good job. All of these things.
100%.
And quite frankly, they should be hair transplant doctors primarily.
And just like Ralph said in the chat, this may sound unfair because there's probably some doctors who've taken the time to get big YouTube followings that are good at what they do. But I always do find it suspect, and I have for a very long time. But I think now we're in a time and a place where it's kind of necessary. I mean, these guys feel they can't compete unless they become influencers. Mm-hmm. And it's a fucked up. I think it's a precarious position for any physician because I look at them with a jaundiced eye. A lot of well-informed people may look at them with a jaundiced eye, but it doesn't. It helps their bottom line, so they're like, "Fuck it, what do I care?"
Yeah. Well, like you said, as long as it's not cutting into their surgery time and they're still good doctors, if they've got a good team that's doing it,
yes,
then that's okay. At the end of the day, there's a reason why advertising exists as an industry because it works. It drives people to your door.
Yeah, 100%. 100%, man. All right, Morty. Well, we're going to take one last call before Joe explodes.
Joe, don't explode, man.
No exploding here. No exploding going on here.
All right, take it easy, fellas.
All right, man. You take care. Good
Thanks
talking
for calling,
to you.
Marty.
Take care.
Bye-bye.
Anytime.
All right. Wonder what he's doing for St. Patty's Day. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hey, this is the big pain in the ass, Rob Hellner.
Oh, my God. Rob Hellner has a fucking voice. What's happening?
He does. He's real.
I am real. I heard
Right
Joe
on,
say
man.
my name that I to piss people off. I'm good, Joe. And the jokes are always jokes just to get you to say something there, Joe.
Dude, are you from Minnesota?
No, I'm from Michigan.
Michigan. Okay.
Close enough.
Close enough.
Cool.
Yeah.
Yeah, right on.
And it's just a joke, Spencer, when I say you spray the back of your head.
Oh, dude, come on, man. You're hilarious in the room.
He was texting me behind the scenes going, this hilarious guy again.
He's lying.
I gotta try to keep up with Morty.
Fucking Morty, man. Morty the Yenta.
Yeah.
Good luck with that, man.
Holy shit. Do not take that guy to court, man.
Hell no, I just don't want to say BHT to Joe.
Oh, no, that's not what Mr. Kobren said. Mr. Kobren said this.
Yeah. I got it recorded.
Yeah.
So I just wanted to...
I present
Exhibit A.
Yeah, I was going to say Exhibit A.
Yeah. I just wanted to call.
What's going on, man?
I could keep up with Joe. Well, 8 hair transplants later, I'm getting to where I'm starting to like it.
I didn't even know your story. What is your story? You've been in the chat for forever. Tell us your story, man.
Well, in 2016, my hair didn't start to fall out till I hit 40. then I figured I didn't even know about minoxidil or nothing. So as it went along, within 5 years, I was, like Spencer says, Norwood 6 for mica board.
Wow.
Okay.
So, of course, I didn't find you guys till a little later. I had my first 2 hair transplants. The first one was a doctor. He was a complete clown. And what I found out is he took all the hair he took out of the donor, he spliced them up into singles and said I had 2,500. So he was a joke.
Who was he?
Then his name was Dr. Berkowitz out of Sterling Heights.
No shit. Good old Dr. Berkowitz.
Yeah, he's just a doctor that does liposuction and facial stuff.
Yeah.
And he has a technician that he flies up from Ohio, like you guys are saying, and she does all the work.
Okay.
And then my second was I went to, the next 2 I went to the Suit Man in Chicago, Yates.
Okay.
The Suit Man. I got to tell you, that guy is the sharpest dressed hair transplant doctor on the planet, bar none.
I can't even imagine what his closet. I can't imagine his closet. I can't even imagine what he must have like 20 shoe racks. He may have a closet just for his fucking shoes, this guy.
That's true. I tell you what.
Yeah, go ahead.
He comes in, he's got his white robe on, but you can see a tie underneath. And he took it off once, and he had a nice suit on. Then he went in the back as the girls finished putting the grass in, and he came back in strutting around with a brand new suit on.
Another suit.
I thought that was kind of funny.
He's got a wardrobe change. He's got like a stylist in the back.
Well,
he buys two copies of every suit, one for home, one for the office.
Absolutely. And after that, I went down to Florida, which now that I've started watching his videos, that Dr. Hubner that Joe doesn't like. But I tell you what,
I don't dislike the guy.
Oh, okay. I don't
dislike
the guy.
You
say some of his work looks like it's pluggy.
That doesn't mean I dislike the guy. I'm just not crazy about some of the work.
Doesn't mean he's not going to sit down and have a drink with the guy.
Yeah, but he is a very professional guy. He didn't steer me wrong. The 2 I had, he had 2. It was in my mid scalp, and it wasn't that bad. But then it's like I could still look in the mirror when the sun hit it. It looked like it was like I was a thinning, diffused Norwood 4. But then I went to this Dr. Umar in California, where I think he's near where Spencer is, and that guy was absolutely phenomenal.
It's a couple of hours away.
Yeah, his voice when he talks it's kind of cool.
Hello, Dr. Umar.
I'm Dr. Umar. Just lay back and be comfortable. I shall do the work, and it'll be magical. You will love it. That's Dr. Umar. He's got that kind of voice.
Yeah, I with 3,000 beard hairs, grass now, he put it in my crown and a little bit in the mid scalp. It's been 6 months now, and it is coming in like weeds.
I'm really happy for you, man. That's great. It's good to hear.
Good for you.
And I'm still debating on one in the front, and then I'm done. Be one off from Joe.
Well, how many grafts have you had moved so far?
Oh boy, God, I'd have to count them.
So I know it's probably hard to say.
I'm guessing it may be near 10.
Okay.
With the beard grafts, but it's brought me. I mean, it's been a long road since 2016, but it actually is working.
Wow,
and that's what matters. So good for you.
It did. So I just wanted to call in, beat Morty to the punch sometimes.
Rob, listen, we appreciate your patronage of the show. We appreciate you being in the chat and all the shit that you give us every week.
Yeah.
And I love when you give shit about Joe being late.
Oh, it's funny. It's all in fun.
You're wrong about 75% of the time. It's actually Spencer, but you know.
You know what? I'm gonna be completely fair to Joe, even though I'm lying a little bit. I'll take 50% of the credit. for being late.
The credit.
Spencer, the road rage one was funny a couple weeks ago.
And it was 100% true. And I actually left some parts out.
I see Joe yawning, so I won't hold you guys up anymore.
Yeah, you see, I told Joe about that. I said people have written me about Joe not paying attention to the show, even though he is. We got to somehow hide those yawn. We have to have like a yawn button so that he can automatically switch to me.
I don't think I yawned. I don't think I just yawned.
Well,
I'm hungry as hell, but I didn't yawn.
Let's go to the videotape.
Yeah. You know Spencer's wide awake because it's only like it's only 5 o'clock where he's at.
It's only 5 o'clock where Joe's at too. You got to get your geography in check, my man.
Due north, baby. Due north.
Well,
all right, Rob.
I appreciate talking to you guys. I hope you guys do excellent work.
Thank you, man. We appreciate you.
Thank you very much.
You take care.
You're welcome. You guys have a great weekend.
Thank you. You too.
Bye.
Bye-bye.
Right on. Take care, buddy.
You want to call it a night, or you want to take
nice.
another call? Very nice. Great call.
One more.
All right, we're gonna keep this short, man. Last call.
Okay.
Hey, you're on the air. Who's this, and where are you calling from? Hey, caller. Say hello, or we hang up.
Yes, we're talking to you.
3, 2, 1. Hello?
Oh, hello.
Hello.
He just hung up.
All right. Good night, guys. Joe, give out the websites, please.
Let's see, websites. We'll start with my own website, hairtransplantmentor.com, where you can see my history with 10 hair transplant surgeries. Some were small, some were big. It is what it is. Where I am now. It's good stuff. It's also home to the largest and most comprehensive hair loss and hair restoration glossary that you'll find anywhere on the web. Do check that out, hairtransplantmentor.com. IAHRS.org, International Alliance of Hair Restoration Surgeons. It's a great place to start your search for a hair transplant specialist. Not a definitive list, not perfect across any sort of metrics, but it's a safe place to start. And it is the baseline for whom I consider when I get applications for membership on my website. If you are listening to this podcast on iHeartRadio or Spotify or iTunes, we are broadcasting a video that goes along with this on my YouTube channel. It's youtube.com/hairtransplantmentor, and be sure to like the video and, of course, subscribe if you're not a subscriber, and ring the bell for all notifications when the show is live every Friday and other videos that I upload on a regular basis. American Hair Loss Association, that's americanhairloss.org. The de facto standard when it comes to big media referencing anything and everything that has to do with hair loss. Wall Street Journal, ABC News, Discovery, you name it, they will reference American hair loss when they want to validate their own stories about hair loss or hair restoration and anything that has to go with it. A great supporter of this show, hairlosscure2020.com. It is a fantastic website if you want to know more information about coming treatments that are in the pipeline, cloning, hair multiplication, other hair loss treatments that are being worked on. Great resource, great guy. He's supporting this channel and what we do. He embeds it every Friday so that his viewers can also check out the show. ApeToGentleman.com for the UK version of The Bald Truth with Spencer Kobren and Spencer Specs Stevenson. That's ApeToGentleman.com. Great resource and is home to the most widely viewed and most controversial article about the top 25 hair transplant doctors in the world. It's always great fun to read and see the fallout. Go check that out, ApeToGentleman.com.
The fallout of that shit is hilarious to me.
It's a blast. I look forward to it. Thank you, Specs, for writing that, because it just brings a smile to my face every year.
But it also shows me just the pettiness and, in some cases, the stupidity of some of the people in this field. Like when this Ohio doctor contacted me and was like, I don't know what you were thinking, yo. Of course, he didn't speak to me in that manner, but I don't know what you were thinking, Spencer. But to separate the top 20 hair transplant, now it's 25, hair transplant surgeons from the IHRS in the world, just diminishes the rest of us in the IHRS. And I'm like,
but doesn't he pay to be a part of an organization that already does that? That actually does that?
That's actually very true. It's not even an organization. He pays to be part of a website that does that.
A website, yeah.
Yeah.
Doesn't he pay to be part of a website that actually does that already?
Oh, and he still does.
And he still does.
Yeah. So I'm just like, listen, you might want to read the byline because there's another Spencer in this business. He's in the UK, and he writes these articles for these newspapers and for these blogs, and he's on the fucking byline. I didn't write that shit.
And you know what's funny is if he was actually in that list, that shit would be all over his website, all over social media. Look at me.
And I told him, I said, I'm a lot of things, but one thing I'm not is an idiot. That would be fucking professional suicide.
Yeah.
For me to somehow separate, a third or whatever of my organization out of the organization and say, you know what? These guys are okay. They're all right. But these guys are really fucking good. That would not work out. Now, I know that there's a website that does that, which is hilarious to me. But we're society. We're an organization. That's not what we do. But I find it fascinating. And then also some guys who have been on the list, who are no longer on the list, and all of a sudden they're like, the list is shit. But the year before, they're like, the list is all over their fucking websites. It's amazing to me.
It is.
God, you type loud.
Oh, don't get me started, Mr. Clackety Clack.
What?
You were the worst. You were the worst.
So why don't you bring it up? Bring it up. Well, I'm usually in some sort of a fucking, panic when that's happening. Something's going on.
Yes, I know. I understand.
Anyway, guys, we had one of our hair transplant doctors who contacted us, and he's like, "Oh, you should tell Joe that temporal angles are all dependent on they can be twisted or moved around." I forgot what he wrote. I don't have it in front. I do, but I'm not going to look for it. Essentially, that what? Let me read what the fuck he wrote because I don't want to sound more of an idiot than I am right now.
I was like, I don't know how to respond to this because I don't even know what you're saying.
Tell Joe that the graft can be rotated as it's placed into the recipient site, which is critical as it determines the correct direction of the curl of the hair. Fuck that up in temporal points and eyebrows, or really anywhere on the scalp, and then the result will be inferior. And this is determined by the graft placer. No shit, Sherlock.
Yeah, but the general idea is when you make the incision in the proper angle and direction, that dictates 97% of every result. Like, yeah, there are situations where the rotation.
Those are fighting words. Let's see the stock calls in.
They will assist in the angle and direction, but you can't make up for shitty angle direction with the recipient sides by simply rotating a graft.
Well, that's what I've learned.
Can't do it.
That's what I learned in my 25 years of Hair Transplants 101. So, but there's some nuances.
And I understand what he's saying completely, whoever this is. I completely understand, and I do agree to an extent. But in the case of my situation, like, my grafts are going like this, and that couldn't be fixed by rotating them a certain direction. They'd still be sticking straight up and looking like shit. So it's small nuances that can influences. And it's interesting. That actually brings up a question for me. I don't even know this. And if I could get the answer to it, I'd really be appreciative. But how do we know that the rotation of that graft actually influences the growth? Because that hair shaft sheds later on, and what determines that it's going to grow in the exact same angle and direction that it did before it was placed?
I'd
like to know that.
That's a very well thought out and lucid question, my man.
Thank you. I pull one out every once in a while.
And maybe we'll get the answer to that on the next episode of Spencer Kobren's The Bald Truth. All right, guys, we're going to go.
Joe Tillman.
Yeah, with Joe Tillman. With Joe Tillman. Jesus Christ, everything.
Hi, I'm over here. Hi.
Always got to give the guy credit. Your fucking face is on the show every week. Isn't that enough?
No.
Oh, Jesus.
No, I'm the co-host, bitch.
All right, we're gonna have a little. I'm gonna get like a fucking little sticker. I'm gonna put it across.
There you go.
With Joe Tillman.
Yeah, I'll have a placard.
Yeah.
Joe Tillman.
Yeah.
With an arrow.
Yeah. Actually, the arrow should face down. There's a lower third there, right, that you can see? You have the arrow facing down right next to Spencer Kobren's The Bald Truth, right in the center with Joe Tillman. Just put it right on your desk, right there. You see, you could fit it right there.
Yeah, right here.
Yeah.
Right there.
Right, the other side.
There.
Move your hand to the left. Move your hand to the left. Move your hand to the right. Left. Yeah. Right there.
Yeah, there. Right there.
With Joe Tillman.
Okay.
Okay. I'll let you do
angle.
that. All right, guys. Until next time, be strong. God bless. And thank you so much for listening. Take care.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you.